Alrighty, I'm gonna get going. Thank you so much again for everyone who's here. My name is Evie, as most of you will already know that. I'm the CEO of Coolamon Community, and today we're super excited to show you something that we've been working really hard on in collaboration with a lot of you. And thank you for all of those who did provide us with feedback on this project. Our video series is a key part of us being able to continue to grow, also to continue to support you as you have staff turnover and those kinds of things, just to make sure that your team's really clear on what Coolamon Community does, what a Coolamon is, and how they can really get the most out of using it out in community. Before we go any further, I will acknowledge country. I am on Arakwal country of the Bundjalung Nation, and I acknowledge all of the different nations and mobs the country that you're coming from and the mobs that you either belong to or the mobs that you're working with. It's such a privilege to be able to work in this space around birth, which is the very center of absolutely everything. So, before I continue talking and before we get into the videos, I'm going to hand over to Skye Stewart, who some of you might have seen was the 2024 Australian Midwife of the Year. And she very gratefully said yes to working with us on this project and just brings such a wealth of experience, over 20 years as a midwife, working in stillbirth, working with red nose. So just a really broad experience, and decided that, yeah, she'd come on board with us and do this video series and share with us all of her knowledge, all of the things that she's been able to impart with the communities and families that she's worked with over her time. And we're really grateful. So, Skye, over to you.
Thanks, Evie. Yeah, really excited to be here. Very excited to be here, actually. So who am I? You can see me on there every time. I feel like Pam and Evie see me. It's like, what color hair have you got this time? It's purple in the video series. It's pink now. But aside from my hair color, my name is Skye Stewart, and I'm a Wergaia and Wemba Wemba woman. So from the Mallee in Victoria. It's really beautiful country out here. It's very flat, not a hill in sight, but it's beautiful sky country out here. I often tell people how I grew up as a bush kid, so I didn't see the ocean until I was 16, and it terrified me because I was like, I can't see the other side of this. That's terrifying. I grew up on country. The country that I grew up on, one of my own Aboriginal countries, which is Wergaia country. And, you know, I always talk about, before I start, of who I am in my professional life as one of the many hats I wear, is that I come to you as an Aboriginal woman first. For Aboriginal people, for a lot of our mob, we are raised by more than just our mum and dad. We have big community mob, and so I always like to acknowledge my mum, my nan, and my uncle Mark, who really raised me, and each of them held the same roles, you know, different roles, but the same amount of responsibility to me. For different reasons. And so I think it's really important when we're looking at work that we do with mob, that we're coming in with that approach, that it's not just the mama that you're looking after it's the whole mob that's, you know, going to end up being a part of the education or care that we give. So my background is as a midwife, but before that, the journey started because I became a mama when I was 19, had my first baby, one of 6 babies, and then also now joined the best club in the world, which I highly recommend to everyone, which is the Nan Club. I've got a 10-month-old grandbaby, and he's the best thing that has ever happened to me in my whole entire life. My kids know that. After I had my first baby at 19, I had some really stark experiences. Both of them were either really positive or really negative, and both of them really affected who I was, what I was actually going to do with my life. So after the birth of my first baby, I decided that I might try and give this whole midwife thing a go. So one of the experiences that I had in the postpartum experience with my son was the way I was talked to by some of the staff, by the midwives. I felt like who I was as like a young mum, an Aboriginal person, was really dismissive. A lot of the care that I received, I felt like I wasn't heard, and it was a really tricky time in my life. And I remember leaving that hospital and just thinking, I think I could do this job better than some of those mob. And so I went back and finished year 12, baby in arms, and started a journey on midwifery, which is 20 years long now, and I still love it. So in the journey of becoming a midwife, about 5 years ago, I stepped away from the clinical role. And even though I love working with families directly, what I come to notice is that there's a lot of other ways that we can support families, as we know, with, the Coolamon Community Safe Sleep Space is one of them. I jumped into the world of research and came to my attention that what we were seeing was that a lot of the care that our Aboriginal mamas and families were receiving was a bit subpar. It was culturally unsafe. There were lots of talks that the care that they received was more traumatic than some of the other experiences themselves. And so I got into the world of looking at some of that bereavement space. So looking at bubs that had passed away from stillbirth or SIDS and SUDI. So I started my journey at Red Nose for a few years, where I came across different safe sleep spaces for babies and what that can look like for Aboriginal families, which is where I met the wonderful Pam and Evie when they brought along their prototype for their Coolamon, which was just beautiful. And I hadn't seen, anything quite like it in the terms of what was available for safe sleep spaces currently. I remember having that conversation and just thinking, these guys are really onto something. So we know that, for Aboriginal people, that we do have a long history of harm within the healthcare system. We have a history of the forced removal of babies that creates a really, significant and deep trauma within our families that spans generations. We know that, the systems for us have been a place that's really hard to trust. And when I was looking at the Coolamon and what the Coolamon represented and how it was going to be able to support our families, to me, it felt like a way for further connection with mob, keeping our babies safe and well, acknowledging the past hurts that have happened, and having something that really nurtures our present and our future. I think when Evie and Pam asked me to jump on board with this Coolamon project in this video series, I was very excited. I had just finished a year before. I just finished a large project. I had received a fellowship where I wanted to do something in terms of supporting families after stillbirth. And within this fellowship that I had received, I created a resource called Star Baby. And Star Baby is it's a handheld resource guide that's used to support Aboriginal families following stillbirth. And so it can be used by any mob anywhere. And it's my baby. It's something that I'm really, really proud of. And after that was launched, I was able to there ended up being funding available for Star Baby to be printed and then sent out to every maternity service hospital in Australia, which happened 6 months after the launch of it, which to me was just mind-blowing. I needed a little break after that. That was a big project. And so when this Coolamon mob came across and asked me to be a part of this video series, I thought, here's something beautiful. Here's something that's meaningful. Here's something that can change families. Support mob in ways that work for us. And in saying that, it's been really beautiful to see how it's come from like this small little place in Northern Rivers, and how it's just rippling out in the beautiful ways that it is. Or as we say for mob in Victoria, we call it the Corey grapevine. I'm sure it's called other things in other places. So I'm going to leave it at that and pass it back to Evie. But I think the last thing I would say is that, being able to be here today to look at this video series launch, it's a really proud moment, because it's something that, I really believe in, to have, something for mob that is hope inspired and something that does support us to look to the future, because sometimes it's really easy to get stuck in that things are really hard. But to have something like this, I feel like it's walking into the future together with our babies safe and well. So thanks, Evie.
Thank you so much, Skye. I love listening to you speak. It just makes me so proud of you. Um, so the way that we see these videos being used is, yes, in that clinical setting, you can use these videos. We'll have them available on YouTube as well. So I'll send over the links when that is up. So you can use them in the clinical setting to go over the things like safe sleep, nurturing baby, feeding baby, everything that you're going to see in the 6 short videos today. And the other way that this can be used is that because they're going to be housed on YouTube, the families can actually access those after the fact as well. So sometimes when I know, having 2 babies now, that you're there and you're getting so much information, and to take it all on and to remember it all in the moment, especially when you're pregnant, like, oh my goodness, it's a lot. So to have something that they can pull up afterwards when they're not sure, how was it that I'm supposed to sterilize the bottles? I'm feeling a bit unsure about this. Is there support available? And they have this at least as a first port of call. And then the care that you guys provide obviously comes after that and really wraps around the mums. We've also spoken with some more remote health services who are interested in having this dubbed in language. So we will be pursuing different forms of funding to be able to achieve that. But if the community that you're working in, if that's something that would be of interest, then please reach out, just so that we know exactly how many communities and how many languages we would be looking at. That's really going to help us forward plan on, when we're presenting that to funders, what should that look like? Beyond that, we also would like to see this video series kind of resource grow. So particularly looking into expanding it when it comes to safe sleep, not just don't do this, or this is what safe sleep should look like, but this is what safe sleep spaces look like. And this is why we do it this way. So really giving the families the information that they deserve to understand why safe sleep should be done in certain types of ways. So it's not just all of this, don't do this and don't do that, because that we know that that just doesn't hit the mark. And again, having that available in language. So these are the other things that we're working on. Pam, did you want to say anything before I kick the videos off?
No, I don't think so. I think you've mentioned everything. We'll have a little Q&A at the end, and people can ask us anything then. So no, enjoy.
Wonderful. Thank you. Now bear with me while I get the videos up. I'm hoping it won't take long. Coolamon Community creates a positive impact at the very start of life for an Aboriginal mother and her baby. The Coolamon gift is so much more than just a beautiful gift of essential items. Yes, it does provide every Aboriginal mother that we support all of those material gifts, but more than that, it connects her and helps build trust between the mother and her culturally safe healthcare provider. The role of the healthcare professionals in the Coolamon Gift program is absolutely central. They are the link between us and the mothers, and they make sure that the women are not only receiving their incredible healthcare and all of the knowledge that they provide, but that they can go home and actually implement those things for their baby, for their family, and have those better health and wellbeing outcomes. This video series is here to guide health workers and mothers in using the Coolamon as a resource. We'll cover the essentials of growing healthy babies, including safe sleeping, nurturing, feeding and soothing, and products that are safe to use on babies, whilst keeping culture strong in every step of this journey. Our goal is to set clear expectations that every Coolamon is given with guidance, every conversation matters, and every baby is given the safest, strongest start in life. We invite you to join us in making these moments meaningful. Together, we can nurture healthy babies, strong families, and proud connections to culture. The Coolamon is more than just a baby bed. It is a safe sleep space that has been lovingly curated specifically for Aboriginal mothers. One of the most important things I want mums to remember is we care. We see that you come from a legacy of strong, powerful women, and we are here to support your motherhood journey.
Creating a safe sleep environment for babies is really optimal for their health and well-being. What we know for babies is there is a higher risk of SIDS or SUDIs, and the rates of those are quite high for babies that are under 6 months of age. So what we really need to look at for little babies is to make sure that when they're sleeping that they're safe. Wrapping for babies can support them in feeling safe and secure. You know, you think about the times when mum was pregnant with baby and baby was in utero, so they're used to being all squished up, all comfortable, and it gives them a sense of comfort of being wrapped in that way as well. So we do that by taking the corners across her chest with their arms covered. Yeah, perfect. And if there's any left at the bottom, that's just able to be tucked away. Now she's snug as a bug. One of the main areas where we looked at that actually reduced the rates of SIDS in babies is putting bub to sleep on their back. It actually reduced the rates of SIDS by 80%. Bub doesn't need a lot of the extra things that we might think comforts them, so they don't need any toys in there, they don't need pillows, because their safe sleep space needs to be flat and firm. Just bub in their sleeping suit and a blanket, and that's all. Keeping the room smoke-free really supports bub's airways and keeps their lungs nice and clear, keeps them healthy. The Coolamon is made of natural fibres. The mattress within it is firm and flat, which is what we need for bub. It comes with a fitted sheet that is made from cotton, which is a breathable material and which is really good for bub's skin. The Coolamon is very lightweight and it's very easy to transport anywhere where you may go with bub. For these reasons, the Coolamon is a very accessible and safe option for safe sleep for bub. Gentle touch and bathing is really powerful for bonding for the family. This is because babies rely on touch from their trusted caregivers. It supports Bub to feel safe and connected with those who care for them. That's good. Putting him in nice and slowly. You don't need to wash your baby as many times as you might think in the week. Babies are generally pretty clean anyway, so often 2 to 3 times a week is all you need to do. A baby's skin is delicate, so simple, natural products are always best. QV Baby Gentle Wash is really good for this. It's really gentle on their skin. Bub's skin is pretty perfect, but every now and then they will have like little dry spots on them, so you can use this cream. This one's really good. It's QV Baby, the moisturising cream. So this is the QV Baby Barrier Cream, so we often use this for babies for their nappies. It's quite thick, and that's because of the zinc that's in it, which supports with healing, so if there is any nappy rash, it supports that healing quite quickly. A lot of parents will often ask about reusable versus disposable nappies, and both options are fine. We often say that when dressing baby, we just add 1 extra layer to baby compared to what we're wearing. If you notice your baby becoming a little bit hot and flushed, just take a layer of their clothing off. If you feel like the room temperature is a bit hot or stuffy, open a window to create some breeze to come in. Nurturing is about the everyday little things, like cuddles, warmth and comfort. Keeping babies warm and dry helps them feel safe and loved. Feeding time can also be bonding time. What we know about feeding baby is that breast is best. We know that sometimes breastfeeding isn't possible, and that's okay. Fed is best. There are different formulas that you can use, and you can talk to your midwife or the lactation consultant about this. Feeding in those early days can look different every day. Trust your instincts, seek support if you need extra help. There is support available. An easy and affordable way to sterilise bottles is just by the boiling method. With that, all you need is a pot and some water. What's great about this method is you can do it anywhere, at home or if you're out camping. Once they're in, we make sure that they're completely submerged, making sure there's no air bubbles. Let's bring it to boil now, and it's in there for about 10 minutes. All we need to do now is let them air dry, and then we pop them into a sealed container until you're ready to use them next. Our babies rely on us to soothe them because they don't know how to do it themselves. Babies love movement, and they often find rocking helps soothe and settle them quite quickly. In my experience, skin to skin with Bub from either mum or dad really supports in that bonding. It regulates their temperature, it reduces their stress hormones, and it builds a really beautiful connection between baby and the parents. These techniques support the baby to soothe in a time when they're not able to soothe themselves.
The Coolamon is more than just a baby bed. It is a safe sleep space filled with gifts lovingly curated specifically for Aboriginal women. The Coolamon gives mothers confidence in the first few weeks because it allows mums to receive the information that they're getting from their culturally safe healthcare professional, and then have all of the resources that she needs to be able to implement those things at home when she delivers her baby.
For the families to receive something that is culturally safe, appropriate and safe for baby really makes a big impact. I think the Coolamon works really well for areas in remote Australia because unfortunately there is a higher risk of SIDS and SUDI in those areas. For mums to have that cultural pride and sense of identity during pregnancy and birth supports them in really having a sense of belonging. A belonging in who they are as women, as mothers and as Aboriginal people.
Thank you for it. Just having the bassinet, so when baby was born he used it for a good couple of months until he grew out of it, and all the little essentials. I loved it. We used them all, and the ones that I could save, like some of the little clothes and stuff, just passed it down. It's just something in you that you just feel connected.
It's really, really important for our kids, our young people, our future elders to know their connection to their part of their country. That connection is even more important today.
As a midwife of almost 20 years, one of the hardest parts of that role is supporting families who have lost a baby. Stillbirth and neonatal death are quite rare, but they still happen. My name is Skye Stewart. I'm a Wergaia and Wemba Wemba woman from the Mallee, Victoria. I'm a midwife, a mama of 6 and now a nan. I'm the creator of Jibba Pepini Star Baby, which is around supporting Aboriginal families who have lost a baby from stillbirth. Something that really touched me was knowing that Aboriginal families have a higher rate of stillbirth than non-Indigenous people in Australia. When we look at rural and remote areas, we know that the rates are even higher. Knowing these facts, it hit me straight in my heart, and I was looking around to see what was available for Aboriginal families following stillbirth. I couldn't find any resource that was specifically for us, and so I thought that was something that needed to change. I spoke to many families across Australia and heard really painful stories with families that were really vulnerable and beautiful in their sharing with me. What I took away from it was taking all that information alongside my midwifery knowledge and then creating something for the families in this time. I often talk to families about it being a big hug from your favourite aunt, and it's there to comfort you through a really painful journey. The Jibba Pepini resource is available online. You can download it or you can order a hard copy for yourself. You can find it on the Stillbirth Centre Research Excellence website.
Amazing, Skye. Yet again, I just always get so moved by the way you speak and where you've put all your efforts. I'm just going to grab up my PowerPoint slide again. Tell you what, there's a bit of toing and froing in this sharing screen business. All right. That's good. Everyone can see. We've got some time. I just wanted to make this really quick and snappy, obviously respecting everybody's busy schedules. But if there was any questions about the content, about how it could be used, about our plans for future content and what that could look like, As you know, we're very open to any and all of it. We want to hear what you have to say so that we can make sure that we're doing our part and in supporting you. That's essentially what we see ourselves doing. So we want to make sure that we're hitting the mark every time. No questions at all.
Where am I going?
Yep, we can hear.
Oh, hello, it's
Hello.
Francine. I've got Simone with me,
Yes.
and we've also got our lovely midwife, Lee. We're in Group Island, which is a long way from everybody. And we're about to present our first Coolamon to one of our new mums in community. So we are really absolutely thankful, and we are really looking forward to doing that, and hope that it builds a sense of community. And yeah, we're really looking forward to it. It's been a bit of a journey to get here, but we're here now, and we can't wait. We've got a lovely new mum that we're so excited to give her the Coolamon, show her the videos, and hopefully it'll be the start of something very special for the mums and babies of Groote Island. Thank you.
Thank you so much for sharing. That's so exciting. We've been, in connection with you guys for so long, and we know how hard you've worked to get to this point, which is just a testament to, where there's a will, there's a way, and never tell a woman she can't do something because she's going to prove you wrong and make it happen. So just an amazing achievement for the three of you, and I hope the process of giving that mum her Coolamon is something that's going to support her and really benefit her on her motherhood journey. I'm so excited for you guys. I wish I could be there for every one of the, gifting, but unfortunately that's your role and not ours. But we love to hear the stories and see photos where possible. It just it really warms our hearts and makes us feel a little bit like we were there, at least in spirit.
Yeah, we'll certainly post for you. Just for the other people that are online now, on Groot, most of the items, including baby beds, you can't actually purchase on the island. So most of our Aboriginal mothers, or not most, all of our Aboriginal mothers co-sleep because you can't buy a cradle or a bed on the island, and to get one on is really expensive. Things like singlets, things like that, you also can't buy on the island at all. So pretty much all of the products in the Coolamon, our mothers won't have had or had experience with. So we're really excited about that, because they'll have something new for their babies and something new for the mum, which is pretty good. And in regards to the sleeping, that's what we wanted to promote, was safe sleeping options for our families, which they haven't had in the past.
Thank you.
Fantastic. And just Simone, it's Pam here, just checking, everything arrived quite well with Australia Post. Were there any issues with them?
No, all fine. I picked them up from the post office yesterday. All of it, yeah, it was good. And that's the only way that we get it. The problem is, once it gets to Darwin, it has to come over on the barge. So depending when it gets to Darwin, like they got to Darwin quite quickly, but it missed the barge. So then it's another 2 weeks.
Okay. All righty. Oh, that's great to hear, though.
We've still got some time, so if there's anyone else that wants to question or share or talk about your work, we're always happy to hear, and if you're willing to share.
Oh, it's just me again. It's for Pam and Evangeline. So where to next, ladies? What's happening next? You've done such a wonderful job.
Thank you. So next on the to-do list is obviously continue to support all of the communities that we already support, and that requires, ongoing seeking of funding, just to make sure that our commitment maintains in the communities that we've started delivering to. The second part of that is obviously expansion, but so long as it's done in a sustainable way. We've also launched Coolamon Baby, which you may have seen, which is our social enterprise. So just supporting ourselves as much as we can on that journey, to hopefully be completely self-sustainable at some point in the future. But you have to start somewhere. So we were really happy that we're able to do that, sharing stories of powerful, empowering Aboriginal motherhood in artwork translated to blankets. We've also got a really exciting clothing line with some of that artwork with bonds later this year. So very, very exciting for that to happen, and will really just help bring that traffic to our website and the visibility of what we do and how we do it, and hopefully continue to promote that empowering motherhood lens that we really want to put out there, rather than the deficit discourse, which has been much more common in the past. We're hoping to do things differently and to profit off it so that we can continue to support the mums. And then the other part of that is we want to continue to create video resources and do so in language where possible as well. So yeah, if you're out, working and there's something that you think, man, I would really like to have a video resource for this specific thing, please let us know, because we would love to put that kind of in our wish list of what we want to create. And then that gives us a really clear picture when we're going to our funders and asking for the what we need to create XYZ videos. As I said, we've got a focus after the NT coroner's report, which I'm sure you guys up at Group would have read. We will have that focus on safe sleep. But if there's any other things that we didn't cover in our initial video series launch, we would love to know so that we can do that in later ones, and just really provide whatever supports that you guys need to support what you do in clinic, and then to give that support to the mums and families when they're not, in front of you and face to face.
That's great. Thank you.
Thank
I was
you.
also going to mention the resource boxes. And the resource boxes is, I think you all know about the resource boxes, but it's a great resource of larger size bundles of clothing from, we go from 0 to 1 or up to 1 year old with clothing bundles. So when mums are coming back for vaccinations or further checkups as their baby grows, it's great to have those. So if you need anything specific in that first year, the resource boxes is what we've designed to help address that. And we can, as we get cleverer, and we've got some brilliant volunteers at our end, we can put together more tailored resource boxes for you. So don't forget about those. There's clothing bundles, there's some larger nappy bundles that we get from donors, and a number of other things. Yep. And yeah, we love working with you all, and I'm so pleased that Australia Post is doing a good job, because I want to not.
You never know. We pack them so beautifully, and then the truckie comes and picks them up, and it's like, oh, I hope they get there safe. Libby or Danielle, did you guys have a question before?
Yeah, no, it's really important that women know how to sterilise bottles. I'd love to see, the promotion of breastfeeding.
Mm-hmm. Yeah, definitely.
That mentoring is so powerful. And the other thing I'm really interested in, and it actually came from a client, just getting women's birth stories out there. Like, this was a woman that had had 2 previous sections, and then has just had a vaginal birth. So, yeah, and I'd love to get the deadly stories out there. Yeah,
I love both of those ideas.
Podcast, designated for Aboriginal women,
Mm-hmm.
To get their stories out there.
Yeah, that's a wonderful idea. I think there's definitely, as you said, like an identified clear gap in in that market. And yeah, we'll put Pammy's writing it down on her to-do list. I can see her doing it right now. Look, it's on our list. Oh, I think I've just lost audio on you, Libby. Go again.
Sleeping. Most women are going to co-sleep. So
Yep.
that I'm dealing with, how do we promote safe sleeping around that? Yeah.
Yeah, we've spoken about that specifically with Skye quite a lot, is making sure that we're creating content for them that is realistic to what their actual sleeping space, and then how can they tailor that as much as possible to be as safe as possible for baby, using the Coolamon. And also, realistically, they're not always going to use the Coolamon as well, so what do they need to be doing and be aware of? Yeah, we're really interested in that space specifically. Thank you. Is there anyone else who wanted to pop in?
I think Jackie's speaking, but we
can't hear you.
You're on mute.
Sorry, I was mute. I just would like to say thank you so much for this wonderful job that you are doing. Our clients they love it. The other thing I would like to say that it has impact on the workers, like our colleagues as well, because we share when we give to the woman, and the the reception or the other, and they can connect to each other, and so it's been amazing. And I'm going, if you authorize me, I'm going to put this in parenting groups, like moms and babs groups, and just is one more thing that we can, including our programs that can help the moms and babs, and it's wonderful. It has been like one of the best things we have had from other organizations. Yeah. So thank you so much.
Thank you, Jackie, and thank you for all the work that you do. I know you always in the car driving from one health service to another. You're a very busy woman, and that feedback is really helpful for us because it helps us tell our story when I know I keep talking about funding, but as you guys are aware, it's key to everything. So the more little pieces and feedback that we get, it just helps us create that story and picture of impact. And yeah, I will send over the YouTube links once I upload them. So then you'll be able to share those on the parenting groups as well. So that can be a resource of support in that space as well. Thank you.
Thank you. That will help a lot. And just another question, because donations to the organization can be from just a person or from an organization, or how it works?
Yeah, so we have a donations page on our website, and individuals can set up just, like a once-off donation, or they can set up a recurring donation, just depending. We've had quite a few come through because everyone's getting into end of financial year mentality at the moment. And then as far as organizations go, they would normally reach out to us, or we would have done an application with them, and then that'll normally be like a direct bank transfer as well. So there are a few different ways of what it can look like, just depending on where it's coming from and the how much they're going to give as well.
Okay, because Baby Give Back, they do is just a tip or an idea. They do this emails or text messages and things, and it's been really good. So and we do as like organization as well. So we donate through, one organization to you and many organizations together to you. So I think it's a good idea to have this emails going. Yeah, so we can share,
Yeah, thank you.
expand, because beautiful organization that must expand.
Thank you very much. I think we're always really aware of your time in the work that you guys do, and secondly, not bombarding you with emails too. But obviously, we could be obviously doing a little bit more in that space, and that's a great idea. We're such a fan of Baby Gives Back and everything that they do. Their CEO, Carly,
Yeah.
great mentor of mine, and really grateful to have her as a friend. So yeah, I really appreciate that idea. Thank you, Jackie.
You're welcome.
Alrighty. Well, I might wrap everything up there. Thank you so much, everybody, who's either listening to the recording or who had the time to drop in for some time today. Yeah, I will let you know when these are up via email, and always our email or our phones are open to hearing from you whenever you guys need. Thank you so much and have a great rest of the day.
You too. Thank you.
Bye.
Bye.